So the neurology consists of mostly, uh, looking head CT and MRI. So you have to master this skill. The easiest way to master this skill is having an organized approach, as I said, organization. So always look at the normal side first, symmetry. Is the right side similar to left side? Are the spaces same? What are the spaces? Lateral ventricle, third ventricle, fourth ventricle, all those things. And parenchyma, uh, is the stroke on the right side or left side? I will go into the depths little bit more, and the different windowing techniques, and as beginners try to see all the sequences and compare side to side. Okay, that is the first step of organized approach. I will skip these slides and I will hit the most important things for your purposes. Head CT means, if you see calcium, see that picture here, if you see calcium in the scan, most likely that is head CT. See how thick it is and bright. But head CT is kind of taking picture with your iPhone 1. MRI is kind of taking picture with your iPhone 10. So it has better resolution. But what is head CT good for? It is good for looking at bleeds. If there is blood in the brain, head CT you can do it in 3-4 minutes. For doing MRI, it takes 1 hour. You have to screen the patient. Is there a pacemaker? Is there a metallic like gunshot wound? Like if there is metal in the body, you can do MRI, right? So that's why we start with head CT. Make sure there is no blood in the brain. How does blood look in the head CT? Blood is very bright in the head CT. I will show the pictures. And the next, MRI brain. So people got Nobel Prizes, with MRI brain. It's such a important technique. But I will summarize whole MRI brain into 4 sentences. The number 1 you have to remember is flare sequence. Flare. Write this down. Because when you see, next 1 month you keep doing this, right? Flare sequence is kind of like hemoglobin A1C of the brain. Means it shows how does your brain looks like, for the last 40 years. Next one is diffusion weighted imaging, DWI. It is acute stuff. If somebody is having acute stroke, it can pick up acute stroke, within 30 minutes. It is so bright, DWI. The next thing is ADC, apparent diffusion coefficient. But before going there, diffusion weighted imaging, stroke looks like bright, so bright, like this light, right? I will show the pictures. And next is ADC, apparent diffusion coefficient is cousin for DWI. Stroke looks dark in ADC. And the 4th sequence you have to remember is flash or echo. It is good for picking subtle blood in the brain. And the 5th sequence, all the time medical students, residents, nurses ask this question: do we have to do head CT with contrast, without contrast? MRI brain with contrast, without contrast? The answer is, when do you have to do this with contrast is if you are looking for any break in the blood-brain barrier, then you have to do these studies with contrast. Okay? What are the conditions where there is break in the blood-brain barrier? Meningitis, encephalitis, cancers, lymphoma, glioblastoma multiforme, multiple sclerosis, herpes encephalitis. I think these are the top few things you have to remember. Any infection, inflammation, cancer, multiple sclerosis, abscesses, all these disrupt blood-brain barrier. So that's why you need MRI with contrast. Okay.